Is it okay to do it alone, or should a couple always do it together? When and how frequently should a couple do it? What should couples talk about while they're doing it? And most important, what should it look like? I'm Dr. Greg Kovacs, and I'm going to talk about the ins and the outs of couples counseling. Couples therapy can focus on a pretty broad range of issues, things like trust and betrayal, communication, intimacy, child behavior problems, first-time parenting, finances, work-family balance, and that horribly confusing role of step-parents and co-parents. These are all things that couples therapists secretly love wrapping their brains around. So these problems can happen in any kind of relationship, whether you're married or not. So no, you don't have to be married to attend couples counseling. In fact, I meet very often with couples for things like premarital counseling and post-separation co-parenting counseling. And yes, good couples counselors are trained to work with couples from any sexual orientation, any gender identity, any relationship type. So you've decided to attend couples counseling and you're finding a bunch of counselors with a bunch of different titles and even more letters after their name. So where do you start? Well, in New York State, there are 6 licensed mental health professions. And while none of these disciplines are better than the others in helping to create change, their training and their specialization and their clinical approaches can be somewhat different. So some are better at some things than they are at other things, and that includes couples counseling. So should you choose a marriage and family therapist when searching for a couples counselor? And the answer is no, not necessarily. Yes, marriage and family therapists are specifically trained to understand complex relationship dynamics, so specializing in couples counseling, it's kind of our thing. But other mental health professionals can pursue additional training to become really good relationship counselors. In fact, 2 of my most influential mentors were social workers who pursued advanced training to become extremely effective relationship therapists. So any licensed mental health professional can become a skilled couples therapist, but know that couples therapy is a specialty and that every licensed therapist has that skill. In fact, there are practicing marriage and family therapists who focus on work with children or with individual adults or even on a distinct problem dynamic within families. But because couples therapy requires distinct skills, be sure to ask a potential therapist if that is something they're comfortable working with, or preferably if they specialize in it. Anyone practicing mental health counseling in New York State, really in the United States, is required to hold at least a master's degree. Right. For those who want to raise the bar and who are willing to pay exorbitant tuition to lose a bunch of sleep and have some ulcers and headaches and develop caffeine dependence and social isolation, little carpal tunnel, poor hygiene, chronic imposter syndrome, there's the option to earn a doctoral degree in all of these professions. In the links below, you'll find a video that I created a while back called Credentials Unraveled, I think it is. I talk about the differences between each of these degrees and whether or not a doctoral level therapist is going to be a good fit for you. A master's degree in marriage and family therapy requires 6 to 7 years of undergraduate and graduate education. So that means a bachelor's degree takes about 4 years, plus a master's degree that takes maybe another 2 or 3 years. After graduate school, the marriage and family therapist then practices for an additional several hundred hours under the clinical supervision of a trained supervisor. So that clinician then has to pass the state licensing exam and is then granted the license to practice. And you can tell a license has been granted by the L before or after one of the credentials. So LMFT is licensed marriage and family therapist. So if you don't see the L, make sure that the yet to be licensed therapist is in fact being supervised by a licensed therapist who is a supervisor. So a licensed therapist who is also an approved supervisor.